I want to welcome all of you to Business Leaders of Color's Lunch on the Block. Today, we are fortunate enough to have Matthew Simone of Homesteady Health. He deals with direct primary care, and he's going to talk to us about some possible options for health insurance for you to get the support you need for your family. Matthew Simone, please take it away.
Hey Gladys, thank you so much for having me. It's a real pleasure to be here, and I really look forward to sharing a little bit of how I can help small businesses sort of provide some healthcare benefits to their team and share a little bit about my business. So a little bit of background about me. I'm a nurse practitioner. I've been in the healthcare business for about 25 years, probably about 20 years now as a nurse practitioner. And I started Homesteady Health here in the Ithaca area about 2+ years ago now, really to kind of provide better access and better relationships in the healthcare space. A lot of people are frustrated with the system, and this allows you for in a membership model, sort of outside of the insurance, to get same or next day appointments as long as you need to build a better relationship with your provider, and they can access me and basically text me anytime they have a need. That's the 30-second summary of the business itself, but over time, realizing there was some really significant needs in the community, I wanted to open this up to small businesses that really want to take care of their employees, but unfortunately, the insurance marketplace doesn't really provide a sort of budget-friendly approach to that, and oftentimes the employees are sort of left out in the cold to scramble for themselves. And that's no fault to the employers. It's just simply unaffordable for a lot of small businesses. Along this journey, I thought this was a great opportunity for me to provide that sort of offering to folks, and I'm hoping to kind of share some of those details with everybody today.
Wonderful. Okay, I'm just going to start with a few questions.
Sure.
So, as a small business owner, how much would health care cost me per employee?
Yeah, so it's a little bit of a variable question. It really depends on the size of your business. My typical rates for the average adult are $99 a month. But for a small business that's going to be bringing onboarding several employees, that price would come down significantly. So depending on the volume, it could be anywhere from $70 per employee per month to, $90 if it's just a couple of folks. But I'm willing to work with employers and try to find a medium as I'm trying to grow this part of my business that's going to work well for both of us and get their patients' needs met. That includes a lot when we really think about it. I do all primary care here, all urgent care type needs are covered as well. It's a small office, but I can, take care of all those needs, rapid testing, stitches, urinalysis. I draw labs right from my facility. All that preventative maintenance that's going to keep an employee from getting a chronic disease that's going to be out for a long period of time. Having all that access also gets an employee back to work faster if they can't get in to see their regular primary care provider, which is pretty standard. They can get in here same day, get a rapid test, get on treatment, and be back to work potentially the next day or within 2 days, as opposed to being out for a longer period of time. So that's a real benefit to the employer, and they're really getting a lot of value. I say approximately 80 to 90% of all healthcare needs can be met with this membership model.
That's wonderful. Next question.
Sure.
Do I need insurance or are there other ways to cover my team?
Well, the question of need insurance is individualized to
Right.
employers by law, but most small businesses aren't required to offer insurance technically. But I think I hear all the time that a lot of people want to offer some kind of benefits. People are frustrated with insurance, so employers are paying a lot of money, and their employees aren't really getting the return on that investment. And oftentimes employers are even offering a plan, but it's a high deductible plan, and patients are paying out of pocket, employees are paying out of pocket for most things anyway, and it's still very affordable for their unaffordable for their day-to-day needs. So direct primary care is an excellent option to sort of meet in the middle ground. It's considerably cheaper than any kind of insurance package than you would offer, and it covers a good, percentage of the needs that you would have. So I think it's a great alternative in those circumstances. If you don't have insurance or you're part of my plan and you don't have, like, if folks come to me and they're a member and they have insurance, we're still going to utilize it for a lot of the ancillary needs and specialty care and labs and things like that. But if they don't, I have lots of very affordable options that I can actually get labs and medicines that are much cheaper than when they would even be with insurance, especially if you're in a high deductible plan and you have to pay for it anyway. You're getting charged what they would charge the insurance, which we know is a very inflated price, but you have to cover it anyway until you meet your deductible. The alternative, very cheap medicines and labs when you're not going through your insurance. So I can offer that to folks as well.
Wow, that's wonderful. Thank you, Matthew.
Sure.
Next question. How do I offer something helpful without locking into a long-term contract?
Yeah, I mean that's a good question. For as far as Homesteady Health direct primary care memberships go, I do not have a long-term contract situation currently in place. If there was a larger business, I might consider that a little bit differently. But right now, if you became a member with Homesteady Health, you can cancel anytime. There's no hassle. I use the gym analogy often for the memberships, like your money just kind of pulls out each month, and you use the services when you need them. But sorry, I got a little bit distracted there. But unlike that gym membership, it's not going to take you 2, 3 months to get the person on the phone to figure out how to cancel it. So if you decide you need to move on, we just have a quick discussion. You have a little bit of time left on your membership through the end of the month, and then I try to set them up with a good alternative for the next chapter of their healthcare journey, and that's about that.
Okay. My next question. Who are the majority of your members? And the question I'm asking, is this families, individuals? Is it small businesses? The majority of your current clients. Tell me
Sure.
about their demographics.
It's pretty wide ranging, but it is a family-based practice. I am a family trained nurse practitioner, so I have basically offer services from the early years all the way through the end of life. So it is a pretty wide spectrum. If I was looking at demographics, the majority of my patients are probably midlife to senior women. But I do have a men's specialty practice as well. So I do see a lot of very specific men's health needs, testosterone replacement therapy being one example. And I assume this demographic will change as I continue to add services, but as I'm entering the women's hormone replacement therapy world as well to offer that need to the community, which is much needed as well. There's a dearth of those providers locally. So I imagine the demographic will change over time, but generally speaking, it's a pretty broad range of folks. Majority of them have insurance, but probably 20% or so do not. So I can meet a lot of different people where they're at in their care. I have some very traditional people that are traditionally accessing care, and then a lot of folks that are used to a more alternative approach. And I just like to meet people where they're at and provide that care on the terms that they're comfortable with. And of course, by providing a lot of evidence and my best advice, but we kind of mutually come to decisions and treat their care accordingly.
Okay, thank you. So, how do I keep costs predictable month to month?
I mean, that's one of the great benefits of direct primary care. You know exactly how much you're going to spend each month. If you're the employer and you have 5 employees at whatever X number, there is never an additional cost. So you know exactly what your costs are going to be every month. And, I haven't raised prices since I started, so I don't anticipate any changes like that. So, I mean, it is part of the beauty of it. When patients come in, whatever they need is basically covered. All of those services that I mentioned before, all the primary care, urgent care, there's no additional charges. There's no copay, no deductible, none of that extra stuff.
Okay. How complicated is it to manage the service that you provide?
For the employer side,
Mhm.
Yeah, pretty straightforward. I work with a third party called Hint, and they are pros at doing exactly that. Their entire business model is built on direct primary care and connecting them with employers and making that process smooth. They can onboard patients very easily in the software, and it does create a nice separation between the provider and the employer so that patients can know that they have the confidentiality in their healthcare that they deserve. So it works pretty well for everybody, and it's a pretty smooth transition.
Matthew, what do you love most about the work that you do?
Oh, that's a great question. Honestly, I've been burned out of healthcare multiple times over from different jobs and different roles. And I thought I was probably going to be done with healthcare. We moved up here. I thought I'd open a cheese shop or something like that because I was so tired of it. But that's more about frustrations with the system and the inability to not provide the care that I know my patients deserve. So coming in direct primary care, I can really take time and sit with my patients and really allow them the chance to be heard. So patients can sit down and really let me know all the things that are troubling them. There's never a rush. They're never having to cram 6 months of problems into a 5 minute visit. So it gives me the opportunity to really build relationships, for me to really sort out complex problems that oftentimes the system just doesn't have time for. And it's no fault to any of the providers. It's just the way things are set up nowadays that they're rushing through patient care and patients are not getting the quality of the care they deserve. So it's been a joy operating in direct primary care and being able to get to the back to the root of why I started this journey a long time ago, right? And that was to be able to provide that kind of care that the system has sort of taken from us for a long time. So I love being able to sit down with patients and really hear their story and to have the nuanced approach that it takes to solve their problems.
Well, I can tell you that I am thoroughly and completely grateful for the work that you offer because as I've been aging, I've been watching, going to, of course, more doctor's appointments, and they will bring you into a weight room. You sit there, they call your name, they ask a few questions, they will weigh you. There's weeping and gnashing of teeth when I see my weight, but then they will put me into another weight room and I wait there even longer. And it feels like it's some sort of process. You're just a part of, okay, we're going to move you from point A to point B, then B to C. And by the time you get to F, you finally see the doctor.
Yeah.
Uh, and so that can be challenging.
It's funny you make it you describe it that way because I often use the analogy that the corporatization of healthcare, the system at this point in time, it feels exactly like that. I, as the provider and the machine, and patients are reduced to widgets. And the way that the structure is set up now, it's just all about moving as many widgets along the assembly line as possible, and it has nothing to
Yes.
do with the quality of care. And it's moved away. It's been gradually working that way for a long time. So. Really, I don't think I've had a patient wait longer than a minute in my waiting room ever. So, they get here, they often come back early, and that's just part of the beauty of it. If I'm ready for them and they're ready, let's just get it done. So there's never a wait for an appointment. There's never a wait once they get in here. And in between, often they might just have a quick question that we can address, just with a few texts and save them having to take a half a day off of work. So it really works out well for everybody involved.
That's wonderful. Can you think of any changes in the industry that we should be aware of?
Oh boy. Well, it's rapidly evolving. We are coming toward the end of open enrollment here in another couple days, and I think one of the big change, that we've all seen is the rising cost of healthcare, and this is still being sort of debated with our government as of now. I believe the subsidies that most people were utilizing to be able to afford insurance are still not in play. So people's insurance rates have gone up, anywhere from 20 to 50%. And for many people, they just can't afford that anymore. So it's not even a question of how, it's just not possible. So I think that's a big challenge for folks. We already kind of hit on the corporatization of it. And I think we all feel that every day. And I don't see that getting any better. So there's obviously a lot of nuances beyond that, but I feel like the bottom line is patients, we're paying a lot more for healthcare and getting a lot less back in return.
Indeed. One of the things that Um, I guess it happened within the last year or so, maybe 2 years now, is them asking for money before you sit down and see it. And it's I walk
The
in and they're saying, okay, we need your copay right now,
I
whatever
see.
that copay happens to be.
Hmm.
And that can be challenging. I understand why, because yeah, you'll get paid late because you'll get paid late. And of course, it is a business, but I always considered this a business of care. You are
Yeah.
caring for individuals, you're caring for human beings, you're caring for souls. And so, how do you balance? Here's a human being with, okay, these are their medical needs, and I can't sit here with you for 3 hours, even though they may need 3 hours of work, because they also need therapy, they need this, they need that, the rest of it. How do you balance that?
Um, Well, I think the first part of the question is sort of money related, and
Hmm.
that goes away pretty quickly with the membership model, right? You know as the patient exactly how much you're paying each month, and it never really comes up again. It just pulls out of your bank account or your paycheck. So I can imagine the feeling of starting a an engagement with a healthcare provider with "Did you pay me yet?" being a pretty awful way to start. So. I
Right.
mean, obviously, we get that sort of thing out of the way in the beginning, but that never comes up again in a visit. There's never a
Mhm.
conversation about money. So that part pretty much just goes away. Balancing time, one of the other beauties of direct primary care is because of the membership model. So from the business side of it, from a provider's end, I can kind of set my patient panel to what I think is going to be the manageable amount to be able to deliver on the promises that I make when we sit down and have that first meet and greet. And that number is very small compared to what a patient panel would be in the system. So you might see anywhere from 2,000 to 4,000 people on a panel, and some crazier places even more. They've got to manage all those patients. With the membership model, I can manage and maintain my business and keep the lights on in a way that I can set that number so that I know that I'm still delivering everything that I've promised and giving people the time that they deserve. So it's actually pretty straightforward.
Okay, what is one thing that, what's one thing that you would like our viewers to take away from this time that we're spending together today?
Yeah, I think the biggest thing is that there are other ways to provide amazing benefits to your team. It doesn't always have to be the insurance model. And while direct primary care is new to this area, it's been around for a long time and it's proven to be effective. It's proven that patients get better care because they tend to utilize it more. We know that it's a more cost efficient way to provide that care for employers. So I hope that people will listen and say, hey, maybe this is it sounds new, it sounds different, maybe it's a little scary, but maybe it's worth taking a try at something different where I can at least stand out amongst my peers that are offering absolutely nothing in terms of healthcare benefits to their team. I can be the one that steps up and says, you know what, I really do care about this. I really do want to take care of my team, and they can do it in an affordable way.
Yeah, so I mean, for anyone who's watching this, the intention was to give you an alternative to what's currently out there because we know, with insurance and of course the rising costs of insurance, there are a lot of small business owners who could have maybe one, two employees, they could have five employees, but they cannot afford insurance for them. And so, what I wanted to do was share this information and definitely and especially share the work of Homesteady Health and Matthew Simone, because it's an alternative, and we often don't have alternatives.
Yeah, if I
So
may, Gladys, and I really
please.
appreciate the platform and the opportunity here. If folks are really interested in learning more, there's a few ways they can do that. First, I do free meet and greets, so anybody could set up that right from my website, which is homesteadyhealth.com, or you can give me a call at 607-882-6001. I'm happy to talk through some of this complicated insurance stuff. put out a whole series on social media. So Facebook, Instagram, and YouTube. You can go in over the last 3 months, and we called it Insurance Quick Cuts. So essentially, you can go in and learn everything you need to know about open enrollment and how insurance works and how you can use it to your advantage and save money. Also, where direct primary care fits in. So really, it's just informational about how you can approach that. You only got a couple more days left, but you might still be up against it and waiting last minute to make those decisions. So there's a lot out there as far as resource wise, and I'm happy to help anybody along that journey.
Well, we're finishing a little early, and I'm okay with that because this is lunch on the block, and chances are some of us are hungry and we want to eat our lunch. And
Before you
Brian,
before you go eat your lunch, why don't you tell people what your intentions are with Lunch on the Block? Because you're relaunching this year and you want to do it every month, right?
yes, yes, maybe twice a month. So the intention with lunch on the block. And I also failed to introduce myself. So I'm Gladys Brangman, and I'm the CEO of Business Leaders of Colors. We are a network of small business owners, and our intention is to help our members do better business. And if that means we're helping them put their business out to the world, helping them determine who their customers are, what type of marketing they need. Every small business owner has different needs. We work with you to determine what those needs are. I would love to say that we can do all of it, but we cannot. But what I do have are a lot of resources out there. So if you're curious about the work of Business Leaders of Colors, please go to businessleadersofcolors.com and check out what it is that we do. Our intention
Yeah.
is to give a platform to our members. So any of our members who have a service to provide, whatever work it is that they're doing, we will be sharing that throughout 2026 and giving them all an opportunity to create a recording, to be a part of something like this. We will be inviting people so that they are exposed to more potential customers and clients. So that's really the intention, is exposure. And it's an opportunity to tell people what you know, because in our respective fields, we're experts in that. And this is an opportunity to tell the world just how great we are. So that's really the intention with Business Leaders of Colors. With that, I want to thank you all for being here. And I look forward to seeing you at the next Lunch on the Block. Have a great afternoon. Take care.